and skin cancers and all of that, because it tends to be a thing that all of us avoid or overlook sometimes, right?
Definitely.
Okay. Well, you're going to tell us all about it here in just a moment. But first, we have a message. Oh, and then our other special guest is Scott Dorne. And if you don't know who Scott Dorne is, you're going to here in just a second, because he is the new superintendent at Wellston City Schools. So we're going to meet him and talk about his past and also what the future holds for him and the Wellston City School District. So we're excited about that as well. All right, well, we do have another message, and we will be back in just a second and talk with Dr. Tran.
I have no idea.
Cheryl's running the board today. She's
Just keep talking.
okay. All right. Well, do you want to just keep talking with Dr. Tran?
Yes.
Okay. Well, we won't have a message. We're just going to talk with Dr. Tran.
All right. Great. Sounds good.
We may never end today. All right. Well, very good. No, okay. So welcome, and tell us a little bit about how long you've been at Holzer and how you got here.
Sure. So I've been at Holzer for about 1 year now.
Okay.
I joined last August. My path here, basically, I grew up in Houston, in Texas.
Okay. Long way from here.
It was a long way. I don't know if I should mention where I went to college, but Michigan.
Get out. No, just kidding. It's okay.
And I went to med school back in Houston at Baylor.
Okay. Very cool.
I did not know a lot about radiation oncology in medical school. It's not really a standard part of our curriculum.
Okay.
Surprisingly, because cancer is a big topic.
Exactly.
So it's only, you really only find out more about it if you specifically requested, and maybe you had a family member that you gained exposure that way, and then you became interested. But so I actually went into a different field at first.
Okay.
I went into neurosurgery for 2 years, and then I switched. I found about this during neurosurgery residency and switched over.
Gotcha.
I did my residency in Charleston, South Carolina, and then I've been here since August.
Very interesting. And well, we're happy to have you here.
I'm glad to be here.
So when you say radiation oncology, I'm looking at you just
Yes.
so I make sure I say that right. Tell us, exactly what that means. What are the things that you take care of?
So the terminology can be a little confusing sometimes. It's very similar to radiology. So radiologists basically read scans. They
Okay.
usually read all your CT scans, MRIs. We basically use radiation to treat cancer patients. So in the cancer world or the oncology world, the three main treatments are, surgery, chemo, or radiation. So we're one of those three main treatments. And radiation is basically high energy X-rays. We treat a variety of conditions from head to toe, all sorts of cancers, from brain cancer, lung cancer, breast cancers, skin cancer, which we'll talk about today,
Yes.
prostate, the whole gamut. We also treat some benign conditions as well.
So are you located at the cancer center?
Yes,
then
Cancer Center in Gallipolis.
At Holzer. Okay, so which is a beautiful facility, by the way. If you haven't been there, it's really nice.
We do have a healing garden in the back and pretty new equipment. We just got a new CT scanner. Our radiation machine's pretty new. So it's a good facility.
And here's the thing, God forbid that you have to be treated there. None of us want that and for anybody. But if you're going to have to be treated, it's a beautiful facility and a very home-like atmosphere. I get like a warm, comfortable atmosphere.
It is very warm.
Is good.
I've kind of realized being in a small town that so many people know each other. Sometimes we'll have patients come in and our nurse knows them. They're like, oh, that's my neighbor. Or it's just a more personal experience than a big center.
Yes.
But we do also have an affiliation with the Cleveland Clinic Cancer Center. And so we do have resources. If we have a complex case, we can get their second opinion without the patient having to travel all the way there. And so it's a useful affiliation we have.
That's a wonderful partnership. Absolutely. Yeah. Okay, so So you said that sometimes people, if they're personally affected by a cancer or something, they end up in your field. So how did you get, I mean, neurosurgery to this is kind of a leap. So how did you do that?
Well, I was always interested in cancer and tumors in general. I guess I did have a family member. My grandfather had lung cancer, but that honestly wasn't my, I guess, trigger for entering the field. I was
Sure.
kind of too young to really understand much of that at that point. But really, within neurosurgery, I was mostly interested in brain tumors. And so I was interested in tumors
I
in
guess.
general.
Makes sense.
But within neurosurgery, there's definitely pros and cons. The procedures are very interesting. You do really a lot of life-saving procedures. But on the negative side, a lot of your patients are really sick. They're in the ICU, sometimes on ventilators and sedated. You don't always get to connect with them as deeply sometimes.
I see.
And it's just a very fast-paced lifestyle. It was kind of hard on personal life, family life, and everything.
Okay.
So I felt like this was a good balance while still remaining in the oncology world and still using technology to help patients with cancer.
That makes total sense. Absolutely. Well, we're happy to have you here, and we're
Glad to
happy
be
you
here.
made that decision. So let's get kind of into, well, first off, you mentioned that, with cancer, the 3 treatments, which would be surgery, radiation, and then chemo. And I think a lot of times all 3 are utilized, but I think a lot of times people get really confused about chemo and radiation. Could you kind of explain the difference there?
Sure. So chemo is a more systemic treatment. Systemic meaning that it's usually either a pill or an IV, something that travels throughout your entire body. It's not targeted as much. It affects the entire body. There are targeted medications as well. Radiation is something that we aim specifically at certain areas. So typically if you have, there's different situations, but if you had widespread metastatic stage 4 disease, you probably need chemo because you need to treat the entire body. Whereas if you have a focal cancer, a focal skin cancer, something that we can aim at a certain spot, we can treat that with radiation. And we can aim not only at the spot, we can aim at a surgical cavity if you had surgery but had remaining cancer or high-risk features. We can aim at the lymph node areas. So it's a pretty versatile tool.
So typically speaking, what chemo would kind of go first and then really zone in after that on an area? Is that how it would go?
I would say it's a little bit hard to explain because there's so many situations.
Okay.
But,
Every situation's different.
But if you have stage 4 disease that's spread throughout the body, definitely you'll probably need chemo. Radiation is more indicated when you have an earlier stage, non-stage 4 disease. In stage 4 situation, we can treat certain areas to relieve certain symptoms. But at earlier stages, radiation is usually indicated more so than chemo, and chemo is more in later stages.
Gotcha. So here's where I always get confused. So tell this blonde girl, explain this to me. So you hear of radiation causing cancer.
Yes.
But you're using radiation to treat cancer. So
Yes. So
help me out here.
that is definitely a confusing point and a good thing to bring up. So I think that in general, within the public, there's a fear of radiation. There's kind of unknowns about it. People don't
because you
quite
hear
understand.
all kind of
Yes,
crazy stuff.
Exactly.
Yeah.
And so in terms of radiation causing cancer, a lot of the times that's referring to cases where it's done in an uncontrolled manner. So you have an atomic bomb or something that's just a big blast of radiation, or you're just getting excessive scans or things.
Or little bits of it over a long period of time.
Right,
Maybe
things are in a less controlled, less targeted manner, whereas
Okay.
our treatments are very targeted. So let's say if we're treating a little skin cancer on your arm, that should not increase your risk of cancer anywhere else in your body. And they have done studies quantifying the risk of cancer that could be caused by radiation treatments. And usually what the literature says is everyone has a risk of getting cancer even if they've never had radiation treatment before. So whatever your baseline risk is, the radiation may increase that risk by about 1 or 2% in the following 10 to 20 years. So it's a long-term thing. A lot of our patients are elderly. It may not be as pertinent to them.
Sure.
Or, but even so, even if they are young, the risk is on the lower side, and it only pertains to the area that we're treating. It's not going to increase your risk of lung cancer,
of everywhere
brain cancer, things like that.
Gotcha.
And it's very controlled, low dose every day that's aimed very precisely.
Okay. And I know, because I have a million questions for you, but I know, and we need to have you come back and talk about other things as well. But today we want to focus on skin cancer.
Sure.
So let's talk about that for a minute. What factors, I guess, put you more at risk for skin cancers than somebody else?
Yeah, so there's a couple different risk factors. Old age is one.
Like me?
Not like you. No comment. But I wouldn't call
good
you
answer.
in that category. But prolonged UV exposure, sun exposure, people who have fair skin, who have a lot of freckles. There's also people who are immunosuppressed. So people can be immunosuppressed for a variety of reasons. It could be either they have HIV or they could have an organ transplant and they're on immunosuppressing medications for that.
I see.
Or they could be undergoing chemo, which suppresses the immune system as well. Or they just have an immune disorder in general. Also, chronic inflammation and scarring and wounds put you at higher risk too. So if you have a skin lesion that you keep picking at over the years and it just stays inflamed and never heals, that chronic inflammation can put you at risk as well.
Okay. Well, I do know that living where we do here in Appalachia, we are a rural community, lots of farming, lots of construction work, lots of, outdoor stuff. And I feel like that would certainly put some people, if they're not protecting themselves, at a higher risk too. You hear of the farmers getting on the back of their neck or their ears or whatever. So those are certainly factors too, I would have to think, right?
Yeah, they're probably working out in the sun quite a bit.
And men don't want to put on the sunscreen.
Right.
It's not cool.
Right. I feel like putting on sunscreen is a challenging thing. It's easier said than done sometimes. Sometimes for me, myself, sometimes it gets in my eyes or it just feels icky. Sticky.
It feels icky.
So it's we can talk later on in the session about when to use it, but there's what someone might ideally say and then maybe some more practical situations.
Okay, very good. Well, speaking of, what can we do to protect ourselves from skin cancers? And, as you said, there are people that are certainly at a higher risk than others. So there's sometimes that it just happens.
Right.
But
so some things you can do, first off, if you have a history of skin cancer, visiting the dermatologist for routine screenings where they check all of your skin, make sure there's nothing else popping up is a good step.
You'll be happy to know that for the first time in my life, I went to the dermatologist the other day and she did a whole body thing.
Awesome.
So
good. That's excellent.
And she said I was the best exam she'd done all day because I don't have any moles.
Oh, awesome.
So there you go.
Yeah. Speaking of moles and stuff, sometimes it's hard to tell just by looking at something if it's cancer or not. Some things are more obvious than others, but sometimes the only way you know is a biopsy or monitoring it over time or something. But besides visiting the dermatologist, other things you can do, avoid tanning beds. My wife knows a little bit more about this stuff than me, but she said instead of that, you could maybe consider like spray tans instead.
I was going to ask you that because you're thinking about spray tans that probably are fairly chemically. It's like laying on your body. Like, is that? But I would have to think that's still better than laying in the tanning bed.
Because a tanning bed does involve UV exposure, and so that's a risk factor for skin cancer.
Spray tans, they've gotten them
I don't
pretty...
know exactly what's in the spray tans. I've never had a spray tan, but
they've
she says...
they've got... Your wife's like, Trust me. It's
But she said it's better than the tanning beds.
No,
probably.
they have really, I feel like over the years improved. You don't look orange and whatever. But you do need to remember that if you have a spray tan, you're not really, you still have to wear your sunscreen. And yes.
Other things besides spray tan, so she says even for women, some makeups can have some sun protection in them.
They do, yes.
So that's an option to consider. Wearing hats and protective clothing that covers a lot of your skin surfaces. Using sunscreen, obviously. And in terms of that, I would say when to use sunscreen. So I was kind of doing some research on this and seeing what the multiple sources say. And I think there are some sources that are very, I guess, strict about it, and they say you should wear sunscreen 365 days a year.
24/7, man. You should be lathered up.
I'm just not sure that anyone actually does that.
No.
And so I myself, unfortunately, cannot keep up with that as well. But I think maybe a more practical recommendation would be you can check things like your phone weather app can give you the UV index. You can see what it's like on a particular day. Definitely during the peak hours of the day, like from 10 a.m. to 4 p.m. or so, you want to be protected. If you're going to be outdoors and you're for a prolonged time, people think obviously of the beach and the swimming pool, but also if you're out gardening or going for a walk or outdoors watching a football game or anything like that. Other times would be even if you're indoors, but you're next to a window that has a lot of sunlight. So you're on a long road trip and the sun's just on you the whole time.
I was thinking about, I know truck drivers sometimes, that are over the road, they get
Definitely, yeah.
That arm.
Windows in the car, or even if you're in the home, but your window is next to the sun.
Okay.
It is noteworthy that even when it's cloudy outside, the sun rays still penetrate through the clouds. And so, someone I spoke to recently said that they actually got pretty sunburned even though it was a cloudy day.
Yes.
And so that's something to keep in mind.
Because you don't think about it.
But if you're indoors and you're away from windows and you're, have a lot of clothing that's protecting your skin, it may not be totally necessary to lather up at that time.
Are there because again, I go to all the chemical-y stuff, sunscreens. Obviously there are some that are pretty basic, and then there are some that probably are full of all kind of stuff. Are there any that you recommend or that the medical associations are recommending that you could use?
So I think the dermatologist would probably know a little bit more about the different types, but generally you want to use a SPF or sun protection factor of at least 30. And then you may want to consider a broad spectrum. There's the UV has, UVA and UVB subtypes, but some broad spectrum sunscreens protect against both. And then I know that it may just be experimenting with which type is best for each individual person, but there's some sunscreens that have just different, compositions of it, and some of them are maybe better for some people.
Well, I know, for example, I have fairly sensitive skin, especially around my chest area, my neck area. So there have been some sunscreens that I've used on a vacation or something, and they do not mesh well with Jen's body. So it's kind of you need to figure out what works for you. If something breaks you out or whatever, make sure that you discontinue that and do something.
Some that are spray, some of that are powder, some of that are oils.
So
it's just, I guess,
whatever,
see which one works for you.
You do you. Just do the sunscreen.
Right.
Well, let's get into, because I know you brought some show and tell pictures, of which I hear are kind of gnarly. But let's get into the different types of skin cancers and, what people should be looking for, what they could turn into, and what to do.
So if we could bring up that first photo of the types of skin cancer.
Cheryl's working on it.
Perfect.
Yes.
So,
you did it, Cheryl. Good job.
Awesome. So these
Ew.
are These are kind of four different types of skin cancer. Basal cell, and we'll start in the top left, basal cell. So they tend to be described as pink or flesh-colored lesions. And luckily, they tend to be locally aggressive, but they tend to not metastasize or spread as much as some of the other types.
Okay.
On the top right, squamous cell is a different kind. Sometimes they're described as scaly, warty, and those can spread to lymph nodes or metastasize. Melanoma on the bottom left, there's kind of a mnemonic for melanomas. It's the ABCDE mnemonic. So A stands for asymmetry. So if you can look at that lesion there, one half of it is different than the other half of it.
Yes.
It's an asymmetric lesion. B stands for borders, meaning that it's not a clean circular lesion. The borders are kind of irregular. C stands for color. So you can see there's different shades of
Yes.
pigmentation in that lesion. D for diameter. So usually lesions that are bigger than 6 millimeters are more at risk for melanoma. And then E for evolution. So if it's changing and growing and changing in appearance over time, that's something to be concerned about. And then the last one, Merkel cell, is a little bit more rare.
I've never heard of that before.
It is more rare, but I have seen it. And it's basically involves a virus, and it involves one of the receptors in your skin. It's described as this classic purplish/reddish colored raised lesion, just like you see there.
It almost looks like a weird colored mole. Like
It does sort of look like that. And because it's rare, it is important to go somewhere that has experience dealing with them, because the treatment is just a little bit nuanced compared to the other types. But as you can see, sometimes with these lesions, it may be hard to tell on your skin if you have one of these or if it's just a benign lesion. Sometimes you have things on your skin that are not cancer. And so that's where the dermatologist can come and be very helpful. And if there are suspicious lesions, really a biopsy can tell you exactly what kind it is and what treatment is best for it.
So, from personal experience, this happened to me. Well, I told you I went to the dermatologist, and how I got there was I had, and you can see a little thing on my face here. I had a thing on my face that was very similar to what the melanoma looks like.
Okay.
And it it was there for a while, and then it started getting darker. Mm-hmm. It scared the heck out of me. So I went to the dermatologist, and she was like, "Oh my!" Biopsied it. She was like, "I'm really concerned about it," and she was not try it nicely.
Right.
Biopsied it, and it looked almost just like that, and it came back as a age spot.
Okay. Awesome.
Yes.
So that's the thing with going and checking it out.
She was, when she called, she was like, I'm sorry, but I was thoroughly convinced that it was.
It's hard to tell sometimes. Mm-hmm. Sometimes benign lesions can mimic cancers.
Trust me, I'd rather have a hole in my face than have, the other diagnosis. Right. So.
Yeah. So it's not always easy to just look at it and tell exactly what it is. Sometimes the biopsy is necessary.
So she kept apologizing. I'm like, trust me, I'm happy you're calling me with that news.
Right.
Like, it's fine.
Right.
So anyway, so please don't let this stuff go. And understand that if it is one of those things, they're not going to go away on their own. So you need to seek treatment. So with the first step, I mean, I know obviously you're a tool in treating some of these things, but the first thing to do would probably be visit your family physician or a dermatologist. And the way I got to the dermatologist was through my family physician.
Yes.
She referred me.
That would be a good first step, just so that they want to look at the spot that you're concerned about, but also do a complete exam and make sure there's no other areas of concern.
Yes.
And then they can assist with getting a biopsy, because the treatments are not necessarily the same for all four of those types. So knowing what subtype it is is helpful. And there was this phrase in medical school that people said, like, not everyone reads the textbook. And so not every lesion follows the exact textbook picture.
Okay.
So sometimes you may have a melanoma or a basal cell that doesn't look like what I just showed you.
Sure.
And so just getting it checked out and biopsied is a good step.
Or you may have an age spot that looks like a melanoma.
Right.
It's really weird.
Yeah, it's hard to tease out by looking at it.
The good Lord made us all different, and that's just
Right.
more of it. So,
Definitely.
okay. Well, is there anything else you would like to tell our viewers while you're here? Or did you bring more pictures? Okay,
Yes,
let's
I would
go
like
through
to go
more
over
pictures.
some of the other pictures.
Yes, let's do that. Oh,
So I apologize.
whoa!
I apologize for this one being a little gruesome. But essentially, the point I wanted to make with this is talking about treatment options for skin cancer. So
Is that a forehead?
that is someone's forehead. And this is a patient I actually saw, not at Holzer, but previously. Basically, one of the treatment options for skin cancer is something called a Mohs surgery or a excision that dermatologists can do.
Yes.
And I think, generally speaking, that's an easier concept to grasp for a lot of people, that if you have a cancer, you need to cut it out. And people think about that for skin cancer, lung cancer, prostate cancer. That's kind of the easiest one to wrap your head around,
Sure.
is that you got to cut it out. But this is an example of where sometimes the excision can be more morbid or more involved than you may have anticipated. So it is one option, but if you have a skin cancer in a sensitive location, such as the face, or something where it's looking pretty gnarly and the surgery might be pretty rough, it's a good idea to consider other treatment options as an option. So this patient had a Mohs surgery, and they excise the tumor, and then they look at the margins under the microscope,
Yes.
make sure that it's all clear. If it's not all clear, they cut some more. They examine it again until it's clear. And for this patient, they had to excise all the way down to the skull before they were able to clear things. So when you have a lesion in a tricky area on the face or somewhere else, it's just good to consider your different options.
How about we just don't let it get that far before we seek medical attention?
That's true as well.
I'm sure that thing didn't just pop up overnight.
Exactly. Sometimes I am a little bit surprised by how late people come and seek medical attention.
Sure.
But I guess sometimes access to medical care or anxiety, or they just...
Sure. Any number of things.
Any number of reasons. But yes, it
So
is better to treat it earlier.
What do you do to fix the hole in that poor lady's head?
So that's not my exact area of expertise, but I would imagine usually they have to do some sort of
skin
flap, some
graft
sort
or
of
something?
reconstruction.
Oh my goodness.
Plastic surgery may be involved, and it may take a while to heal up.
Oh, okay.
But on to the next picture.
Let's move on. I don't know that this is any better.
So this is an example of a patient we actually treated here. The rest of the patient's pictures are from here, actually. But
Okay.
this patient had a skin cancer of their ear, and basically because of his age and location, the dermatologists and stuff did not recommend excising this. They thought that it might involve amputating a good portion of the ear. It would be a pretty morbid surgery. So he came to us for radiation.
Okay.
And we treated this with radiation alone. It was a number of weeks of treatment.
I'd say.
But it had a pretty good outcome. Basically, the picture on the left is pre-radiation, and on the right is about 1 month after radiation.
Wow.
And you can see that pretty much the cancer cleared up without any surgery at all. And there is an indentation on that right there, but I think the cancer had invaded into some of those parts even before the treatment.
Sure.
But a pretty good result non-invasively.
Okay.
This is another example of another skin cancer right behind the ear.
Oof.
And again, pre and post radiation pictures. He did have a pretty gnarly wound before we even started treatment. So that picture on the right is just kind of a wound that continued to heal after radiation. But the wound care center that we work closely with in these sorts of patients, they said that it was healing really well. We did get imaging and PET scans to confirm that this is not active cancer, but just a wound that's continuing
Still
to heal.
healing.
Right.
Gotcha. So you could have two different things going on.
Right. You could have
Okay.
a cancer, and then you could have a wound that's healing, especially if you get it if you wait so late
Sure.
to seek care. This is an example of not a skin cancer, but this is a patient who had a mastectomy, and this is radiation after she completed all radiation for 20 treatments. And I included this picture basically because, again, sometimes people have fears of radiation based on what they've heard or maybe things long ago. Years ago, they had radiation and they had these awful sunburns.
Sure.
But our technology is definitely much better now. And so after 20 treatments or 4 weeks of treatment, the sunburn on here is pretty subtle, if any.
Oh, yes.
So, yeah, she was pretty happy with the side effects being pretty minimal.
Cool. I mean, it's a horrible situation, but that's a
Yeah.
great outcome.
Yeah, I think it's a good illustration of the side effects are not necessarily these awful sunburns that you heard about in the
Sure.
past.
Very good.
I think I don't know if I have any more photos. Okay.
All right.
But
those
yeah,
are good
radiation-
examples.
Sure, and radiation, just to explain it a little bit more logistically, it's basically just high energy X-rays.
Okay.
So you basically lay on this big machine called a linear accelerator. Basically, it looks like a big X-ray machine, and you can aim it precisely in at the area that we're trying to treat. It's totally non-invasive. It does usually involve a number of treatments, usually a couple weeks of treatment. And for the skin specifically, the most common side effect would be a sunburn. If you were to have anything, that would be gradual and usually temporary.
Okay.
So some people, like her, don't have much of a sunburn at all.
Yeah.
It's pretty rare to see something that's super bad, like historically. But even if it got a little bit more red than hers, usually by the time we follow up about a month after treatment, things are looking back to baseline.
Okay. Very good. And about how long, or does it depend on what you're treating? Does a session last?
That's a good question. So treatments are generally once a day, Monday through Friday, for about 15 minutes each. So it's a pretty
Okay.
quick session. A lot
Not
of
too
people driving there is longer than the actual
Sure.
treatment. But once they get into routine, I think people feel a little bit more reassured that, okay, I go in, I get my X-ray or radiation, I don't feel any worse pain than when I came in, and then you go back, and a lot of people, they come in, they go back to work after, and it doesn't really interfere with your quality of life a whole lot.
Chemo's more the one that makes you sick, and right? Isn't
I
that?
would say, in
a lot of-
general, chemo can make you a little bit more sick. Radiation can too, depending on what your area you're treating. But
Okay.
for skin cancer specifically, usually, if anything, it's a manageable sunburn
Sure.
that gets better over time.
Okay. Very good. All right. Well, will you come back and talk? I mean, I think there's a million different
Yeah.
areas that we could talk about, and I think that would be really informative for people.
Definitely.
And bring more pictures.
Okay. Well, yeah, I'm happy to talk about other types of cancers or answer any other questions, and maybe bring. It's hard because other pictures are usually scans, and they're a little bit less gruesome. But skin cancers usually are not something you see on scans as much as you see
just
visually.
out there. Yeah.
So,
I gotcha. I see what you're saying.
and I did want to demonstrate that a lot of these things could have been a morbid surgery, but the radiation was able to take care of it non-invasively and have good results. So
Or how about we just don't wait that long to seek treatment?
that's a good idea as well.
Hey, listen, I don't know what's worse. Yesterday we talked about the wrestler at the Jackson County Fair that eats night crawlers. So that one made my eyes water also. I'm still bothered by that. So have you ever
That's
eaten
funny.
a night crawler?
No.
No, me either.
So-
Nor do I ever want to. Five? Live. Oh yeah, they're alive
Oh, no,
too. Yeah,
that
yeah,
would be.
yeah.
I'll pass.
As our superintendent's like, what have I gotten myself into? What kind of area am I in? Well, I tell you what, Dr. Tran, thank you so much for coming in this morning. It's been a pleasure talking with you, and I would love to have you come back and we can
Sure.
hit some other areas as
We'll do
well.
some less gruesome pictures
Okay.
next time. Okay.
And you did great.
Thank you so much.
Yes, of course. All right. And of course, don't forget our friends at Holzer are always here to take care of your medical needs. So we want to thank them for being around. So, all right. Well, Cheryl said, have you figured out the commercial situation? Okay. So we have a few messages to play, and then we will be back with Scott Dorne, who is the new Wellston City School Superintendent. So we'll find out what's going on with him here in just a moment.
From breaking news to heartwarming stories, the Telegram is your ticket to the latest buzz in town.
Read your daily dose of local headlines, sports, and entertainment and more in hand and on paper.
Get a print and digital subscription for only $7.95 per month. Delivered fresh every Wednesday and Saturday.
Visit thetelegramnews.com or call 740-286-3023 today.
Don't just read the news, be a part of it.
Saturday, August 16th is Southern Rock Woodstock in the Gallipolis Fairgrounds. This event will feature 3 decades of original artists and legends, such as Leonard Skinner, 38 Special, and Molly Hatchet. In light of this event, Total Media will be giving away 4 VIP tickets. For a chance to win these exclusive passes, comment your favorite Southern Rock song, and our staff will vote on which one is the best. Good luck, and may the best man rock out.
Do great. All right, and we are back. And so, Scott, you are our new Wellston City School Superintendent. So, welcome.
Thank you. Thank you.
Yeah, and it's so great to have you here. And you and I met, I don't know, a couple weeks ago, I believe,
We did.
at the tap room. Mm-hmm. And you were telling me that you actually, I know that you worked up in the Westerville area, but you have family and stuff down here. So isn't that's really cool?
Right. We do have roots down here. My wife, Ann, is from Gallipolis. She's
Okay.
a Gallia Academy graduate and a RIO graduate as well. And what's interesting, Dr. Tran just left. He works for Holzer.
Yes.
My father-in-law was the president and CEO of Holzer Medical Center for many, many years.
Okay.
So we have been in the area for decades.
So you're no stranger to the area, even though you
Not at
didn't
all.
live here for some time. So, well, tell us a little bit about your background, and then because we would love, I think our viewers would love to hear about that.
Great.
And then how you ended up here.
Well, I have been in public education. I'm actually getting ready to start my 36th year in public education, and it has been a real pleasure and an honor to be part of the growth of kids for all this time. I started out as a teacher, a mathematics, high school mathematics teacher. So
You're
I've
one.
taught
Who
the
teaches?
gamut.
Who chooses math? What's wrong with you? No, I'm just kidding.
It's a really enjoyable topic,
No, I
especially when you
actually
can help
enjoyed
kids get to the understanding portion of it. So
I had the most amazing math teacher who made me enjoy math.
Good,
So yes.
good. Yeah, when you hit that right, when you do it right, I think kids can enjoy that just as much as they can enjoy a good book.
Absolutely.
So, and I was also a track and cross country coach for many
Okay.
years. I was president of the Ohio Track Coaches Association at one point in time. So that has been a big part of my life as well. Teaching and coaching is a great relationship. They make each other.
I could see that.
They can help you develop each, in both areas. By doing both at the same time, you get to see kids from a different perspective. And once you get to see them from many different lights, you have a better understanding of how to reach them, I think. And
Sure.
that's been...
And you get to meet the kids on a different level too when you're
Yes.
coaching versus teaching. Sure.
Sometimes it's a little bit more personal, especially in a high school where you have a number of kids come through your door every day.
You get to know them a little better.
I spent several years as an athletic director. I think that athletics and other activities as well, it doesn't have to be athletics, whether it's marching band or whether you're in the theater or any of those types of things. They give kids other ways to engage and develop talents.
100%.
And so I spent a number of years with those in that role and really enjoyed that from it. It's again
That would be
it's a different lens.
Tough job.
You know, the
Scheduling
kids,
all the events.
the kids are the best part of in every job that I've had. The kids have been the best part of the job, right?
Sure.
But yes, it's our athletic directors. It doesn't seem to matter where they are. They are
It's
not
rough.
40-hour-a-week employees.
No.
Let's just put it that way.
Yeah.
So they do a nice job, and you know, as long as your athletic program or your other co-curricular programs are educational foundations in the programs, they're really valuable for a child.
Sure.
After that, I moved into essentially it was like a business manager role, but the executive director of facilities and operations. I had the luxury of leading 2 new building projects. So those are a couple of new schools that have been open
Challenging.
for a few years. That was a great experience for me.
I'll bet you
And,
learned a lot.
I did. You know, I didn't go into it knowing what a backflow preventer was, but now
Now
I
you
do,
know.
and I know how often they need to be checked, right?
Yes.
So, you know, just things like that before becoming a deputy superintendent ultimately in Westerville. So 31 years in Westerville, 35 overall, and very excited to come to Wellston.
Very good. Well, we're very happy to have you here. And, you know, what do you think some of the similarities will be being in a small town and being the superintendent, and some of the differences or maybe challenges that you might face?
You know, I think maybe in a larger community, there might be more opportunities for access to different things.
Sure.
In a smaller town, because you have maybe less people to provide those accesses. Like, for example, Westerville has a small town feel to it.
It does.
You know what I mean?
Yes.
It's still very similar in that regard, but you could leave Westerville and you're right next door. There's another opportunity you might not have had. So
Yeah.
our children here might have to travel a little further for some different opportunities. But you know what's truly the same is the classroom instruction isn't going to change. There are going to be people who are dedicated to
True.
growing children. Building leadership isn't going to change. A building principal here and a building principal on the west side of the state, not going to be any different. They have the same responsibilities and tasks and instructional leadership, those types of things. But you know what I think, and Dr. Tran said it earlier, I am amazed at how nice and welcoming people are. It doesn't matter where I go, and they don't know who I am. It's just wonderful.
You know, and I will toot our community's horn for a moment, because that is the one thing at being in the restaurant business that you hear. We have a lot of travelers come through our area as we are kind of at a crossroads of a lot of different highways, and people stop by, and I swear people are like, "Why is everyone here so nice?" And my heart just swells with pride, because I think that's a culture thing. And I'm glad that you feel welcome and that people have been kind.
You know, I think people are generally nice most places, right? I don't ever feel like that's been an issue, but I think there's sometimes I felt like even myself could be just a little more abrupt in terms of conversation, and let's keep things moving. And
Sure.
It gives me an opportunity to reflect on how nice everybody is to me, how I need to be reciprocal in that way. So it's been I've only been with the district about 7 days as a consultant. I'm not going to be the superintendent until next month.
Okay.
And so a lot of learning going on right now, and the amount of help that people are willing to provide me has been pretty special, to be honest with you.
Good deal. So as a superintendent, what are your main roles, or your main focus for your job?
Well,
are you kind of just like the overseer of the whole situation?
Yeah, I think that's a good way to look at it. You know, you've got your compliance, you've got your political aspects to these types of roles. Being a classroom teacher at heart, I love the instruction piece, and right now, one of our focuses in the district will be on implementing a multi-tiered system of supports. But that's happening everywhere, and so just being able to provide the right levels of support for our team, as you get one chair further away from being in the classroom with kids, your responsibility becomes, in order for you to help the children, is to make sure that you support the staff and provide them the things that they need to be successful. And some of those things are professional development. Some of them are materials and curriculum updates, those types of things. And so my initial focus is going to be essentially a needs assessment.
Okay.
Where are we as a district, and what do we need to do next?
And 7 days in hasn't really probably given you that opportunity to figure
No,
that out yet,
no.
has it?
Initially, when and it doesn't matter whether you're new or whether you've been in the same role for 20 years, the month of July is adjusting to what's the new budget, what are our finances looking like, where are we going to be able to move our team to, what direction do we have the ability to go from that standpoint. But then also July has a lot to do with, okay, where do we have spaces where we need hires? We need a science teacher. So
Like,
if anybody
uh-oh.
out there watching is a high school science teacher, we've got a vacancy.
Hey, there you go. Job opportunity right here on Main Street TV.
So that's what kind of July looks like for a superintendent.
Gotcha. Is money always the biggest challenge for a school district?
I think consistency and knowing what revenue to expect in Ohio, where the state's budget is every 2 years, that biennium budget. The governor just signed really late on, I think it was June 30th, because the fiscal year starts in July.
Okay.
So there's questions all spring that lead up to where are we going to be and what does the future forecast look like. And it turned out to be okay, but it's not over yet because there's still the opportunity for the House to start a process to veto some of the components of the budget. And so that, it's this constant conversation because
Yes.
You're not sure what the target's going to be. Once it's set, then you have a really pretty good look for 2 years.
Okay.
But you try and plan for 5 years, and that becomes the challenge.
I gotcha. That makes total sense. So when you come to Wellston and you look around and you look through the schools and all that, in the whole 7 days that you've been around, is there anything that really sticks out in your mind of something that you really want to focus on or work toward?
During the interview process, I did get to visit all the schools.
Okay.
And so school was in session. So I met a number of students and teachers, and I could just tell you that was the selling point for me.
Sure.
For Wellston. Again, it's that same welcoming, but also the engagement that I saw with teachers and students. So for me, right off the bat, it's going to be coming in and finding out where's the best way, what's the best fit for me to provide additional support. Not that I came in and I'm like, oh, this is glaring and this is glaring. It's about how do I complement the good team that's already here.
That's already there.
They're great teachers.
And if it ain't broke, don't fix it, right?
Absolutely. Yeah. And I think that
We should
happens a
all
lot. I think people come in and they want to establish something and they
With
change
guns
something that's
blazing and-
actually going really well. So, I might have some thoughts, but those really need to be shared with other people, and collaboration needs to set in, and then we see if this is actually an area that we should be working on, or should we be putting our efforts somewhere else, because there's only so much time in a teacher's day, and in a principal's day.
No
We got to make
doubt.
sure that we have focus on what really needs the focus.
That makes total sense. Well, I'll tell you what, when you have been here more than 7 days, would you come back and see us again? Tell us what you're
Sure.
thinking about the school year and
Yeah.
and some of the fun things that you've done and that you're working toward.
Absolutely. I'm really looking forward to August 1st, not just because it's the first day, but it's also the first day that almost half your high school comes back on campus.
Yes.
And so you'll have all of your athletics starting with the marching band, and I know that there's a marching band camp that's going to happen before that, and so it gives you an opportunity to connect and actually re-energize you with your purpose. Why are you here in the first place? And so I'm really looking forward to that. But I did get to go to the summer reading program last week, and I'm going to go again tomorrow. But last week there were about 80 students there, and culminating with a lot of activities and reading and those types of things, but culminating with a foam party So I already got to
Fun.
see something fun.
Good.
And then I believe tomorrow, a little trip to the fair. So
There
I'm
you
very
go.
excited about the fair.
Just don't eat any night crawlers.
No, but maybe an elephant ear.
There you go. Now that I could sign up for sure. All right. Well, Scott, thank you so much for stopping by today, and come back and see us when you've had a little bit more time to assess things, and we'd like to know what you're thinking.
All right, great. Thank you.
Absolutely. All right. Well, I'll tell you what, Pete Wilson is here, and since we got started a little bit late today, we have some time to talk with him. So I think we have another message, and then we'll be back with Pete and some news.
Did you know Jackson is home to a locally owned and operated full-service print shop? Zip Printing covers all your print, signage, and design needs. From business cards, booklets, and posters to yard signs, banners, screen-printed t-shirts, oversized signage, and more. We can help you or your business advertise and look good doing it. Zip Printing also offers logo design. Allow us to assist you in building or elevating your brand today. Zip Printing is located in the Stockmeister Plaza at 708 East Main Street in Jackson, Ohio. So stop in or give us a call at 740-286-3023.
At Vinton County National Bank, we believe in supporting the areas where we live and work. Now, we'd like to honor those who also serve our communities. Our new Community Champions account is especially for first responders, veterans, active military, and anyone employed in the fields of healthcare or education. This account offers rewards, discounts, and other benefits to those who give so much to others. Vinton County National Bank, rewarding those who serve.
All right, and we are back. Cheryl did it again. She's really nervous every time she pushes a button over there. So we're proud of you, girlfriend. No, we are back with our good friend Pete Wilson, and I know that you have some fair stuff to talk about today.
Yes, we're going to do the skinny version of what's going on, and we'll talk mainly about the fair because something's going on every day, and there'll be new things today. But just want to go over some of the winners yesterday from the livestock sale.
Sure.
And I tell you, one person probably stands out. It's dangerous when you make those comments, but I'm going to do it. Jade Roach, who is in the goat show, all right?
Okay.
I've heard that name before. I can't remember what she's done in past years, but she's one of the senior members of 4-H and participant in the livestock sale and the market shows and the competitions and so forth. All Jade did yesterday during the goat show, she was the winner of the Grand Champion Market Goat. She had the top county bred market goat and the runner-up county bred market goat. You're obviously allowed to take 2 goats.
Yes.
And her 2 goats won 3 of the top 4 prizes. And guess what? The only thing she didn't win was reserve champion, and her other goat that wasn't the grand champion was 3rd place. It would have, she was just one spot away from sweeping the board in the market goat category.
That is wild.
So congratulations to her. We will definitely track her down and get her picture. And of course,
For sure.
she'll be back later for the livestock sale since it is a market animal. And also, I left something out. She then won the showmanship for market goats.
Of course she did.
Okay, 4 out of 5 of the top awards there. In the Dairy Goat Show, Ava Miller was the overall Dairy Goat winner. In the Market Breeding Goat Show, Jordan Swackhammer was the overall Breeding Goat winner. Earlier in the day was the Lambs. Abigail Easley was the top entrant for market animals or market lambs. Abigail was the grand champion winner. Ashton Fannin had the reserve champion. Brentley Newman had the top county bred market lamb. Abigail Cooper, the top county bred runner-up market lamb. And Cole Callahan, whose family has deep roots with lambs, the Armstrong family, so the branch of the Armstrong family. Cole was the rate of gain market lamb winner. In the showmanship competition, Ashton Fannin, who had the reserve champion market lamb, was also the showmanship winner. Today it will be cattle, beef cattle, dairy cattle.
Lots of cattle.
Right. It starts early. I believe one of the contests is over. They started with alpacas today, which is, they did
really
that
cool, yeah.
Not that many, but, I'm not sure how many they had, but that was scheduled first. Then we have, all the cattle, the beef, and kind of end with what a lot of people consider the marquee livestock market competition, the market steers this evening at 7 p.m. So that will be all day at the Joe Morgan Livestock Arena. All right, tonight, And I have heard that this guy is really good. I've
Yes.
seen him on tape, not live. Cletus T. Judd is going to be the top attraction at the grandstand. This is really the only musical entertainment, you might say, that's scheduled this week, because it's thrill shows, all the other evenings, which, sell well here in Jackson County. But Cletus T. Judd, who does not swallow night crawlers, does entertain the crowd in other ways.
That.
He has made himself a national name for really the past 4 decades, doing parodies
Yes.
of country songs and of country performers. And as you know, you're not as old as I am, but there was a time where with many people, country wasn't cool. Well, it is cool now.
It's definitely cool.
And so my guess is he's more popular than ever.
Yep.
And before, with some people, country wasn't cool. That was, to me, the best country, the classic country from
absolutely.
the 60s, 70s, and even
You
the
got it.
80s. So, but anyway, Cletus T. Judd, 8 p.m. at the grandstand. And you know what? You don't have to pay extra for that ticket.
Mm-hmm.
When you pay your $12 to get in, you can do everything at the fair. You got to buy your own elf veneers, though.
You do.
But that gets
And
you
corn
gets you
dogs.
into all the grandstand entertainment, whether it's a thrill show or Cletus T. Judd or big time wrestling, as it was last night. So. That is the fair schedule for today. It will, of course, go through Saturday. The Vinton County Junior Fair is just around the corner.
Mm-hmm.
And want to do a little promo. Our Wednesday paper, which is out, had lots of Jackson County Fair coverage, 4 or 5 different pages with pictures and coverage. But the Vinton County Junior Fair even overlaps a little bit. They do a parade on Friday in downtown MacArthur. Their Queen's Contest, and people will be coming into the fairgrounds on Saturday. The Queen's Contest is on Saturday night, and the pictures of all the girls who are contestants for not only Queen but the grade level attendants, their pictures and just a little bit about them, their parents and their club. It is in today's paper, so you can see that, as well as a schedule for the Vinton County Junior Fair, all that. So a lot of fair stuff. I don't want to say that our paper is only fair, but there is a lot of fair stuff. In this paper, and there will be for the next 2 or 3 editions. We will be at the livestock sale this Friday for the Jackson County Jackson County Fair. Have all that coverage in next week. It's just the culmination of all the hard work that the kids do raising their championship animals and their animals that are not championship animals, but they also get sold. They always get a better price than the market price, and so many people from this community come forward. Not just the big companies, but the small companies, the organizations, the individuals even come out and buy these animals and support the kids. So that will be 3 p.m. this Friday at the Joe Morgan Memorial Show Arena, and then Vinton County the next week. Remember, last year they did it on Saturday morning, and they're going to do it again. That will be a week from this Saturday morning, the final day of the Vinton County Junior Fair. That's when they will do their livestock sale. If you remember, and they said that was a trial last year, but they're doing it again this year.
Worked out well.
It must have worked out.
It must have worked
Keeps
out.
you from being up real late if you have to be there the whole time. But anyway, there is so much more, Jennifer, but we will do that tomorrow.
Well, we appreciate that, Pete, and we appreciate you always stopping by.
Well, that is okay. It's nice to hear and see Superintendent Dorne coming from Westerville and stepping into the shoes of Dr. Rao, who was very good about coming on the show and very good about working with us here at Total Media and the Telegram and on the radio as well. We wish him well in his next position. He was great to work with in the 3 years he was here.
Got to talk with him the other day, and he's just a great dude.
A very nice man.
Yep. All right. Well, Pete, thank you so much. We appreciate you stopping by. And thank you to Dr. Tran for stopping by. And, of course, Scott Dorne, our new Wellston superintendent. And so it's been a fun day. Have a great day. Get out to the fair. Enjoy. See Cletus T. Judd tonight. And enjoy some of the fun stuff there. And we'll see you right back here in the morning.
That's right. And you know what? I know it's hot, but it's been hotter at the fair.
Much hotter.
Right. And so, in your 80s, come on, get out there.
Yeah, get out there. You
can do it.
So, all right. Well, have a great day, everyone, and we will see you right back here in the morning. Bye-bye.